on. الكل ده يسمعني والكل طالع عندكم الشاشة السلايد مال
دكتور بروكسي تمام
اوكي ايوبي هم تمام. We'll start in 4 minutes. Good afternoon, everybody. Hope all you are doing well and safe. COVID is spreading. Keep safe. Now, Last week we have studied the pharynx. Now today we will study the other viscera of the neck, which is the larynx. Now the larynx is part of respiratory system. And it's part of conducting airway, just like the nose. The inspired air passes through the nose, through the pharynx, and then enters the larynx, and then reaching to the trachea and the lungs. It's also part of conducting airways, just conduct. At the same time, the larynx is organ of phonation. This means it produces voice. When we speak, the letters are produced by the vocal cords. Now the larynx is the organ, which is an open tube for the passage of air. It lies in the anterior part of the neck at the level of bodies of 3rd till 6th cervical vertebrae. The phonetic mechanism, that is the production of the voice production. This connects with oropharynx with the trachea and guards air passages, especially during swallowing, and at the same time maintains a patent airway. It should not be closed. Once it's closed, then it leads to suffocation. No air will pass into the lungs. It should be kept open all the time. Now I am in slide number 4. Do you see this slide? هسه slide number 5.
ماكو اي سلايد جاي يتحرك عندي.
هي عندك ما يتحرك صوت
الانترنت؟ صحيح السلايد رقم
5 تمام، هو صوت الانترنت مالتك ابني. Now this slide number 5, this slide shows the larynx. You have removed everything from it. Upper thing is this is the hyoid bone, the body of the hyoid bone and the greater horn of it. Below it is the larynx. Till here is the larynx. Now the larynx is formed of an open airway. It's just like a tube, and this tube is formed by cartilages. The skeleton of it is formed by a number of cartilages which are joined to each other by joints, ligaments, membranes, and then over these joints there are muscles which moves the parts of the larynx. The larynx is enclosed within the pretracheal fascia together with the thyroid gland, which lies anterior to the larynx. The thyroid gland lies here on each side, one lobe of the thyroid gland. Now the larynx, as I said, is formed of cartilages, and the cartilages of larynx are nine cartilages. 3 of them are paired cartilages, right and left, and 3 of them are single cartilages. The 3 single cartilages are the largest, and the 3 arytenoid are smaller cartilages. Now this slide number 6, this shows the cartilages of the larynx, which has been separated from each other. The single cartilages of the larynx are the epiglottis above. Then we have the thyroid cartilages, this one, the thyroid cartilages, and then below is the cricoid cartilages. These are 3 single cartilages: epiglottis, thyroid, and cricoid cartilage. The paired cartilages are 2 arytenoids. These 2 arytenoids, right and left, and on this top of the arytenoid lies 2 other cartilages which are very small. They are corniculate and cuneiform cartilages. Cuneiform and corniculate cartilages on each side. So the arytenoid is the largest of the 3 paired. Then you have cuneiform and corniculate. These are the 9 cartilages of the larynx. Now we'll start first with the thyroid cartilage. Now the thyroid cartilage is formed of two quadrilateral laminae. Two lamina, صفيحتين, each is more or less quadrangular in shape. The two laminae fuse with each other in the midline, forming an angulation between them. The angle in the male between them is smaller than that of the female, and this makes this point of junction of the two laminae in male becomes more prominent in the anterior aspect of the neck. You can feel it and palpate it on yourself. You will see the point of fusion and the borders of these two laminae. This we call it the laryngeal prominence. Laryngeal prominence can be felt very easily. In the male is more prominent because the angle between the two thyroid lamina is smaller, while in female the angle is wider, so it's more flat, the laryngeal prominence, giving more characteristic rounded nice appearance for the neck of the female, while in male it protrudes, and sometimes this is called Adam's apple. This, they say that the apple which has been eaten by Adam, given to him from Eve, has been stuck here and made this laryngeal prominence. This is just a joke. It's not true, of course, but this makes the voice of the vocal cords in male more longer than that of the female, and the pitch of the sound it's higher in male than in the female because of this laryngeal prominence and this smaller angle between the two laminae of the thyroid cartilage. Now, next, so each thyroid lamina, it has two surfaces, an outer surface and an inner surface. This is the outer surface of it. On the outer surface contains a ridge extending from the superior to the inferior border. This is called the oblique line of the thyroid cartilage. This whitish one is the oblique line of thyroid cartilage. We have seen in the neck to this oblique line is attached the cricothyroid, the sternothyroid muscle and the thyrohyoid muscle upward. In addition, arises from it cricothyroid muscle, and also arises from it the inferior constrictor muscle of the pharynx. So 4 muscles are attached to this oblique line. From here upward is the thyrohyoid, and from to below is sternothyroid, and from the lateral aspect is the inferior constrictor, and from the center of it is the cricothyroid muscle. Now next, the inner surface of it forms the anterior wall of the larynx, most of the anterior wall of the larynx. It has 4 borders: superior border, lateral border, anterior border, and inferior border. From the superior angle emerges a projection upward. This is called superior horn, and from the inferior angle also projects another projection, which is called the inferior horn of the thyroid cartilage. I have changed the slide. Return back to slide number 5. To the upper border of the thyroid lamina, both thyroid lamina is attached a membrane which pass upward to be attached to the inferior inner surface of the upper border of the hyoid bone from the inside. So it is not attached to this border, to the inferior, but it passes behind it and become attached to the upper border of it. This attachment allows for passage of larynx upward deep to the hyoid bone during swallowing. This membrane is called the thyrohyoid membrane, and on the lateral sides to the horns of the thyroid it becomes thickened. It's called lateral thyrohyoid ligament, and in the anterior medial line also it becomes thickened. We call it median thyrohyoid ligament. Now, the inferior horn extends to the sides of the cricoid cartilage, and this contains an articular facet that forms a joint with the cricoid cartilage. Is called cricothyroid joint. Cricothyroid joint on each side joins to the lateral aspect of the cricoid lamina, forming the cricothyroid joint. The inferior border of the thyroid lamina is attached by another membrane to the upper border of cricoid cartilage. This is the cricothyroid membrane. Again, in the center it becomes thickened. We call it cricothyroid ligament. It's just part of this membrane. Now here we look in this slide number 10. This is the inner surface of the thyroid cartilage. The inner surface of the thyroid cartilage here, all is the inner surface of the thyroid cartilage. Now to the inner surface, of course, this is lined by the mucous membrane. There are two tubercles on each side, one superior and one inferior. Two tubercles, one is here and one is here, two tubercles. Now to these tubercles, emerge from it, this one, the superior one, emerge the vestibular ligament. And from the inferior one, emerge the vocal ligament, which pass to be attached to the arytenoid cartilage. So on the inner surface of the thyroid cartilage, here we have two tubercles on each side, the superior and the inferior. Superior and inferior, and to these two, the upper one vestibular ligament, the lower one is vocal ligament. Above these, the epiglottis is attached to the inner surface of the thyroid membrane above these tubercles. Clear? No. حكيني بعدين ما عندي محاضرة. اوكي. So this is for the inner surface. Then the inner surface sort forms most of the anterior wall of the larynx, and contain these 5 attachments, one for the epiglottis, and then 2 for vocal folds, and 2 for vestibular ligaments. This is the side of it. This is the oblique line here with the inferior constrictor arising from the oblique line of the thyroid cartilage. So this is for the thyroid cartilage. Now next we have the cricoid cartilage. The cricoid cartilage is this one. The cricoid cartilage looks like a signet ring، يعني مثل المحبس الرياجين اللي بيفص مربع الشكل والحلقة مالته صغيرون. This we call it a signet ring. It's formed by arch, اللي هو border of it, the anterior portion of the cricoid cartilage, and a lamina with arch. The arch is anterior and forms, this is the arch of the cricoid cartilage, and the posterior portion of it is the lamina of cricoid cartilage. Now, the superior border of the arch is attached to it the cricothyroid ligament, which attaches it to the inferior border of the thyroid cartilage. The inferior border of the cricoid is attached to the first tracheal ring, to the first tracheal ring by cricotracheal membrane. Cricotracheal membrane. On the lateral side, it carries an articular facet for articulation with the thyroid cartilage, with the inferior horn of the thyroid cartilage. The cricoid, this is the posterior surface of the cricoid lamina. This is the cricoid lamina. It forms most of the, or lower 3/4 of the posterior wall of the larynx. It's more or less quadrangular, the lamina of cricoid cartilage. Here is attached by cricotracheal membrane to the trachea. The trachea has been opened, and this is the posterior or lamina of the cricoid cartilage. To the superior border of the lamina on each side, there is another articular facet, and through this articulates with the base of the arytenoid cartilage on each side here. And this is the other arytenoid cartilage. They rest on the superior border of the lamina of cricoid cartilage, forming the cricoarytenoid joint. And these are the ligaments of this joint, posterior ligament. Just like any other joint, it's covered with ligaments and the capsule because it's a synovial joint. So this articulates with the base of the arytenoid cartilage, and here in the lateral aspect articulate with the inferior horn of the thyroid cartilage. The lamina forms most of the posterior wall of the larynx and forms the anterior wall of laryngopharynx, if you remember. So this is for the cricoid cartilage. Now next we come to the epiglottis. The third single cartilage is the epiglottis cartilage, and the epiglottis, this is leaf-like cartilage. It lies behind the posterior 1/3 of the tongue and projects from the above the hyoid bone, and then it's leaf-like, so it's wider above, and then it has a root. Through this root is attached to the posterior surface of the thyroid cartilage. This is again the epiglottis, the posterior surface of the epiglottis. The posterior surface of it is thrown into small pits, contain these minute pits. These are small pits in this cartilage, which is elastic cartilage, the epiglottis, and these contain mucus secreting glands. The root of it is attached to the posterior surface of the thyroid cartilage in the posterior median line above the vestibular fold. Now the epiglottis is attached to the tongue. You see here, this is the epiglottis. Posteriorly is attached through its root to the posterior median line of the thyroid cartilage. Here above the vestibular fold, from the sides is attached by the thyroepiglottic membrane or quadrangular membrane to the thyroid cartilage, and epiglottic fold to the apex of the arytenoid cartilage by the epiglottic fold. From the anterior aspect is attached the epiglottis cartilage. You see here is the posterior aspect of it to the posterior aspect of the thyroid cartilage. And these are the pits of it. Now, anteriorly, from the anterior aspect, this lies behind the posterior 1/3 of the tongue. And if you remember, we have seen that it's attached to the tongue by 3 glossoepiglottic folds. One in the center, we call it median glossoepiglottic, and 2 lateral glossoepiglottic folds with the valiculi between them. and forms the anterior aspect of the laryngeal inlet. Is formed of elastic cartilage. When you eat food, this becomes pushed backward and closes the laryngeal inlet, so that the food passes into the laryngopharynx and doesn't pass into the larynx. Now, this is for the three single cartilages: the epiglottis, the thyroid, and the cricoid cartilage. Now we come to the paired cartilages, which are three. Again, we have the two arytenoids and then two cuneiforms, which are very small, and two corniculate cartilages. Now the arytenoid cartilages is just like a three-sided pyramid. Three-sided pyramid. It has a base and apex and three surfaces. It has a posterior surface, an anterior, and the medial surface, or lateral, posterior, and anterior surface, or anteromedial, medial surface is the same. It has two processes, one projecting from the base of it laterally, this is called the muscular process, and one projecting from the anterior aspect is called the vocal process. To the muscular process are attached most of the intrinsic muscles of the larynx. To the vocal process is attached the vocal cord. Here is the muscular process. This is the posterior surface of the two arytenoids. They form the posterior upper 1/3 of the posterior wall of the larynx. The gap between them is filled by muscle, by transverse arytenoid muscle. Now, the base of the arytenoid, this rests over the posterior border of cricoid lamina, where it articulates with it, forming cricoarytenoid joint on each side. Here is cricoarytenoid joint. And anteriorly is the vocal process. Here is the vocal process. The vocal process attached to the vocal ligaments, which stretch from the tubercle on posterior surface of thyroid cartilage from here, and pass to the vocal process of arytenoid, one on each side, and they leave a gap here for the passage of air, which is the opening between the two vocal ligaments or vocal cords. We call it rhima glottidis. Rhima, it means opening. Glottidis, it means of the glottis of the larynx. So this is the muscular process, this is the vocal process, and the base rests over the cricoid cartilage, forming cricoarytenoid process. Muscular process receives muscles of the larynx. Vocal process receives vocal ligament. The apex of it is attached to the sides of the epiglottis cartilage by a ligament, which is called airy epiglottic ligament. Here on each side is airy epiglottic ligament, which is covered by mucous membrane, forming airy epiglottic fold. Now, in this ligament, just near to the apex, contains the corniculate cartilage within the ligament, and another one, the cuneiform, also is very small, cunical in shape, and it's contained within these two ligaments on each side, two corniculate and two cuneiform ligaments, cartilages. These are contained within this airy epiglottic fold, which joins from the apex of the arytenoid to the side of the epiglottic cartilage. So the epiglottis is attached to the thyroid root to the arytenoid apex on each side, and from the anterior aspect is attached to the tongue. So this is for the arytenoid cartilage and the cuneiform and corniculate cartilages. Now these, you have seen that they are attached by ligaments, and there are muscles attaching to them. Again, the larynx. Now we are in the second slide. Tamam. Now the larynx, as I said, is part of conducting airways, is organ of phonation, lies in the anterior aspect of the neck at the level from C3 to C6 vertebrae. It's organ of phonation, and this mechanism is designed for voice production, which connects, and the larynx connects oropharynx with the trachea and guards air passages, especially during swallowing. The epiglottis passes backward and closes the laryngeal inlet, and at the same time is formed of cartilages, so it remains patent all the time. Open, this means patent, it means open. Structurally, it's formed of 9 cartilages, 3 single and 3 paired, joined by ligaments, membranes, and they are moved by muscles. Single cartilages, as I said, thyroid, cricoid, and epiglottis. Paired cartilages, arytenoid, corniculate, and cuneiform. Membranes, you have seen, and ligaments, the thyrohyoid, joining thyroid to the hyoid bone, cricotracheal, cricoid to the first tracheal ring, cricothyroid between cricoid and thyroid, the conus elasticus, and vocal ligaments with thyroepiglottics and aryepiglottic. 2 joints, cricothyroid and cricoarytenoid joints. Intrinsic muscles of the larynx are cricothyroid, transverse arytenoid, lateral cricoarytenoid, posterior cricoarytenoid, thyroepiglotticus, and vocalis. The vocal ligaments, these are elastic ligaments extending from the vocal tubercle or posterior surface of thyroid cartilage to vocal process of arytenoid. It is the free thickened superior border of lateral cricothyroid ligament, which is called conus elasticus sometimes. Now, the muscles of the larynx, we call these intrinsic muscles of the larynx. The only muscle which is on the anterior aspect is the cricothyroid muscle, and the cricothyroid muscle arises from this oblique line of the thyroid cartilage and become attached to the lateral aspect of cricoid cartilage, the cricothyroid muscle, which is the only muscle supplied by the external laryngeal nerve from the superior laryngeal branch of the vagus nerve. Now, we have the other muscles all lie on the posterior aspect. Here we have the posterior cricoarytenoid, one on each side, arising from the posterior surface of the lamina of the thyroid cartilage and become attached to the muscular process of the arytenoid cartilage on each side. Then you have oblique arytenoid passing from one muscular process of arytenoid and cross upward to be attached to the lateral aspect of the apex of the other arytenoid. The 2 muscles, they crisscross with each other. They crisscross with each other to oblique arytenoids. To the inside of there is transverse arytenoid passing from posterior surface of one arytenoid to the posterior surface of other arytenoid. And then you have aryepiglotticus muscle passing in the aryepiglottic fold together with the muscle in the vocal ligament. Here in the upper part, the vocal ligament with the conus elasticus contains few muscle fibers which are called vocalis muscle. Now, all these muscles of the here in this picture, this is schematic diagram. This is the epiglottis. This is a vocal ligament, the true vocal cords touching from the vocal process of the arytenoid cartilage to the epiglottic cartilage, and they leave this opening between them. And this posterior portion of it is between the 2 medial surfaces of the arytenoid cartilages. And this is the rima glottidis, the opening between the 2 vocal cords. Now the muscles act on the arytenoid. All the intrinsic muscles of the larynx, they cause adduction of the vocal cords, so they decrease this space between the 2 vocal cords, except the posterior cricoarytenoid muscle, which is abductor of the vocal cord. It abducts the vocal cord. This muscle A posterior cricoretinoid, it abducts the vocal cords, increasing the space between the diameter of rhima glottidis. All other muscles, the oblique arytenoid, lateral cricoarytenoid, transverse arytenoid, all of these, they do adduction of the vocal cord together with the cricothyroid. And the vocalis lead to vibration of the vocal cord and production of voice. Now, all the muscles of the larynx, intrinsic muscles of larynx, they are supplied by recurrent laryngeal nerve, except the cricothyroid muscle, which is supplied by the external laryngeal branch. Now, the interior of the larynx, that is the cavity of the larynx. Here is the posterior wall of the larynx, which has been cut. This is the posterior lamina of the cricoid cartilage, which has been cut, the lamina of cricoid cartilage. This is the first tracheal ring, and this is the cricotracheal membrane. Here is the cavity of the larynx. This is the posterior surface of the epiglottic cartilage, and this is the arytenoid cartilage on each side has been separated from each other, cutting through the transverse arytenoid and the oblique arytenoid muscles, so that's separating these two. This is the medial surface of the arytenoid cartilage on each side. On this side, the mucosa has been removed. You see, you have removed the mucosa from the surfaces, inner surface of the larynx. Here, the mucosa is intact. Now, you see that the cavity of the larynx, starting from the laryngeal inlet, bounded by the epiglottis, airy epiglottic fold on each side, and then we have the two arytenoid cartilages with the transverse arytenoid muscle. This is the inlet of the larynx. It leads to the cavity of the larynx, which is the first part. It's here till the vestibular fold. Then another portion here between the vestibular and the vocal fold, and the third part below the vocal cord, which becomes continuous with the tracheal lumen or tracheal cavity. The laryngeal inlet leads to the vestibule, of the larynx, and then between the vocal and the vestibular fold is the sinus of the larynx, and this leads on each side to the saccule, and then we have the cavity proper below the vocal cords. Vocal cords are the true cords, and the vestibular cords sometimes are called false vocal cords. حبال الصوتية الكاذبة. So it's formed of three portions: the sinus of the larynx, the ventricle, and the vestibule. Sinus and ventricle, and the sinus leads to saccule, which pass behind between this quadrangular membrane and the inner surface of the thyroid cartilage, which is filled by mucus-secreting glands. The mucus-secreting glands, which secretes large quantities of mucus, descending down over the vocal cords, keeping them all the time moist. Once they become dry, then this leads to hoarseness of voice. اللي يحكي هواية عندك زور باش ما وياك دنجي قبض بصوته يبح. This is because of dryness of the vocal cords. Because with speaking a lot, then there will be evaporation of this mucus and lead to dryness of the vocal cords. You should take a rest, and then this will be lubricated, and then you can speak again normally. The mucous membrane lining the larynx is of respiratory type. Pseudo-stratified ciliated epithelium, just like the nasal cavity and the nasopharynx. So the air passes through the larynx, and then once it passes between the two vocal cords through the rhymaglotides, and the vibration in the vocalis muscle leads to the production of voice by the vibration of the vocal cords. Closure or adduction of vocal cords lead to prevent the passage of the of air into the larynx trachea. This occurs sometimes in injury of recurrent laryngeal nerve. This will lead to paralysis of posterior cricoid muscles and paralysis of vocal cord, and lead to adduction of them, and then lead to suffocation. In such cases, we need to do endotracheal intubation for the patients. This is sometimes injured in operations for the thyroid gland. Now, the cavity of the larynx or interior of the larynx. Cavity starts at the laryngeal inlet from pharynx to lower border of cricotracheal membrane to become continuous with the tracheal cavity. It's formed of three parts: the vestibule of the larynx from the inlet to the vestibular folds. Then you have ventricle of the larynx between vestibular and vocal cords. Then you have the infraglottic part below the vocal cords to the tracheal cavity. The rhymaglotides is the aperture between vocal folds, and ramia vestibuli is the aperture between vestibular folds. Sinus of the larynx is the lateral and superior extension of the ventricle of the larynx, which is between the vestibular and superior to vocal cords. Sinus of the larynx, and then saccule, as I said, is extension of this cavity between the thyroid lamina and the epiglottic folds. Here is the vestibule, and then we have the ventricle and the infraglottic part. This is it leads to the sinus, and the sinus passes here behind this epiglottic membrane and the posterior surface of the thyroid lamina, forming the saccule, which, as I said, contains large quantity of mucus secreting glands. They secrete mucus which powers over the vocal cords, lubricating them all the time. Now, the nerve supply of the laryngeal motor is through the superior laryngeal nerve, through external laryngeal supplies cricothyroid muscle. All other muscles of the larynx, intrinsic muscles of larynx, are supplied by the recurrent laryngeal nerve. The mucosa of the larynx till the vestibular folds is supplied by the internal laryngeal nerve. Here is the internal laryngeal nerve, which enters, if you remember, from the pharynx in the floor of the piriform recess, and then pass into the larynx. The larynx supplying the mucosa of the larynx till the level of vestibular fold. Then the rest of the cavity is supplied from the vocal cords downward, is supplied again by recurrent laryngeal nerve, which supplies all the intrinsic muscles. In addition, supplies the mucous membrane of the larynx below the vocal cords. It enters deep to the inferior constrictor, in the gap below the inferior constrictor muscle, the recurrent laryngeal nerve, and supplies all the intrinsic muscles of the larynx except the cricothyroid. All the mucosa below the vocal cords supplies also the vocalis muscle of vocal cords, and injury to the recurrent laryngeal lead to paralysis of vocal cords and lead to suffocation if it is on both sides. If it is on one side, It leads to hoarseness of voice. When you ask a patient with paralysis of one vocal fold, one vocal cord, then he will answer, yeah. What's your name? Let us say it will be like that. What we call it hoarseness of voice due to paralysis of the vocal cords due to injury of recurrent laryngeal nerve. The blood supply of the larynx again is the same from the thyroid artery, superior laryngeal artery. From superior thyroid artery, it enters in the larynx with the superior laryngeal nerve, and inferior laryngeal artery branch from inferior thyroid supplying the area with the recurrent laryngeal nerve enters into the larynx supplying it. You have a question? Anybody? No questions?
No دكتور no.
ولا واحد ما عنده سؤال؟
دكتور
نعم.
ايش كم محاضرة داخل بامتحان الفصل الأول؟
هو أنا شو وقت امتحان الفصل الأول؟
ما أدري بالشهر الثالث.
أي بعد وقت الشهر الثالث. من يقولونا أقول لكم شنو الداخل. نتفق على شنو الداخل.
تمام دكتور شكرا.
No questions?